My name's Mark Cheetham. I'm a colorectal surgeon and I'm the Care Group Medical Director for Scheduled Care here at Shrewsbury and Telford Hospital NHS Trust. Well, that's really important. But as you know, there's seasonal variation in demand, particularly for emergency services, and what we see over the winter period is a more sustained pressure. Although interestingly, it seems that winter arrives earlier and lasts longer every year. Well, we've worked with Vanguard on three different occasions over the last few years for very different reasons. Initially, the first time we used the Vanguard unit was to provide additional endoscopy capacity whilst we were refurbishing our units here at the Princess Royal Hospital. And the second occasion was when we had a need to deal with some backlog waiting list patients, particularly in maxillofacial surgery and orthopaedics. And then the final time, what we're currently using it is as part of our winter plan to add some surge capacity to the hospital. Well, I have to say I was slightly sceptical. Initially, it felt to me like we were going to be doing colonoscopy in a caravan in the car park, and so I had some reservations about that. But in actual fact, the unit is much bigger inside than it may first appear, and the facilities inside are very modern. So, in practice, it was a very satisfactory, modern, and up-to-date facility. Again, I think there was some scepticism from the local press and some patient groups, but actually the reality inside the operating theatre unit that we're using currently is that it's a small but completely self-contained day unit, and the facilities in it are completely up to date as it would be in the main day unit. Well, we had a particular problem with achieving JAG accreditation in that we had to do some building work to develop a separate recovery unit for males and females. Because of the scale of the building work, that meant we had to vacate the unit for some months. Of course, one of the other things with JAG accreditation is the timeliness of access to endoscopy, so we were really keen that we didn't lose any activity while we were doing this. Establishing a mobile unit on our other site meant we could transfer significant amounts of endoscopy activity to the mobile unit and therefore maintain some activity during the building works. But also, more importantly, it meant we could completely vacate the unit and allow the builders free rein to do the work properly. And that's been really successful and allowed us to achieve JAG accreditation. Well, in 2014 we had some particular issues with a backlog of waiting list patients in maxillofacial surgery and orthopaedics. We did consider other options, including outsourcing to other providers. Our experience of this previously is that it's very difficult to find other providers with capacity, and even when we've been able to find that, our patients don't seem to want to move from the local area. So using a mobile unit such as this has allowed our patients to be treated on site by our own clinicians, and that means that we're in control of the whole process and we're in control of the quality of the surgery and anaesthetics, whereas if we'd outsourced that would have been outside our control. Well, I think the reaction of our clinicians to using the mobile units has been very interesting. Again, at first I think there was some scepticism, but the reality is that they're pleasant places to work. We're protected in that unit because it's a standalone unit. It's protected from the pressures of emergency care. So actually, some of our clinicians have asked if we could have the unit all the year round. So I think that demonstrates that they're very satisfied with the work environment in the mobile units. Well, this winter we had a problem because we didn't have an escalation area on this site in the Princess Royal Hospital, and we knew that over the winter we were going to need additional space for medical patients. What we came up with is a slightly creative scheme where we moved one of the elective orthopaedic wards into the day unit, and that allowed us to release a ward for medical patients to be used. We brought the mobile unit on site so we could continue the activity that would have gone through the day unit. So in many ways we've created two moves to create one medical unit, but that's been successful in allowing us to preserve some activity in the day unit over the winter, which otherwise we would have lost, and then we would have had a growth in the waiting list, particularly in orthopaedics and maxillofacial surgery over the winter. In many ways it's worked really well. It's allowed us to keep the medical patients in the main hospital building and move lower dependency, lower risk patients out into the mobile unit, and therefore preserve some elective activity while at the same time dealing with the need for some surge capacity over the winter months. Well, we've worked with Vanguard on 3 occasions over the last few years, and I suppose our relationship with Vanguard has evolved and developed over the last 2 or 3 years. We've now done the enabling works on both of our 2 main sites so that we can deliver and install a mobile unit fairly quickly. Our estate staff and clinical staff are very familiar with the Vanguard setup now, so the setup time is greatly reduced. And I think perhaps more importantly, we've got an ongoing evolving relationship with the company, and that's something that we may wish to continue. We're looking at a major reconfiguration of the hospital over the next few years, and one of our big issues is that we're so tight for clinical space that if we need to do any building work, we have nowhere to decant to. So it may be that our relationship will continue to prosper over the next few years.